So I'm a gastroenterologist, and I practice and live in the suburbs of Detroit, Michigan. I'm a big sports fan.
He became the Rhodes Scholar representative as well as the homecoming king at Ohio State.
You know, what we're trying to do is replicate what you would have, for example, in my office. You know, we want to be real and answer questions that are tough sometimes. Take a topic and really understand it and develop a solution. At the end, we'll help the patient that's in front of us and also help the patients at home as well as in the studio audience. That's the essence of what we want to do. Welcome, and thanks for that warm welcome, and also thanks for you at home watching. You know, today, let's talk about a disease affecting over 22 million Americans. You know, many patients are undiagnosed and rarely know that they have difficulty breathing, sleep apnea. Many years can pass without diagnosis, and folks just become used to the fatigue and daytime sleepiness. Now, patients with sleep apnea have greater risk of high blood pressure, atrial fibrillation, and stroke. So what is sleep apnea? You know, it's a sleep disorder where there's abnormal pauses in breathing or periods of abnormally low breathing. The pause is called apnea. There are two main types of sleep apnea, what we call obstructive and central. In obstructive type, the breathing is stopped by physical blockage and snoring is very common. Now, central sleep apnea happens when the brain does not get signals to the muscles controlling breathing. So what are the risk factors for sleep apnea? Obesity is an important risk factor. So is an increased neck circumference. Now, males and adults over 65 years of age are more at risk. A family history of sleep apnea increases your risk as well. Smoking also increases the risk of sleep apnea. What about the symptoms of sleep apnea? What are they? Usually, patients are not aware of sleep disturbances, and the spouse or loved one is the person noticing the disturbance. And often, there's observed periods when the patient stops breathing during sleep. Daytime sleepiness is also very common, and decreased alertness is also very much noted. Now, loud snoring also, as we said before, is very common. So how do we diagnose sleep apnea? First, we suspect the diagnosis based on your symptoms. Then a sleep study is done to find if you got sleep apnea. You're really hooked up to monitors for your lung, your heart, and brain activity overnight. Now, treatment of mild cases involving some lifestyle changes, including weight loss and stopping smoking. If the sleep apnea is moderate to severe, we recommend CPAP, which is continuous positive airway pressure. Surgery is also used for sleep apnea, but less commonly than CPAP. Now, let's take a look at the story of Denny Doyle and his experience with sleep apnea. Please watch with me.
It's a condition to where you wake up at night, your airway gets restricted, and you basically quit breathing. I went for the testing, and I use a CPAP machine now, which is a machine that forces air through your nasals and keeps your airway open. It improves your quality of life to the point where you've got your energy back. You're not falling asleep. You're not tired, wanting to take a nap all the time.
That was great. When we come back, we'll meet Denny. Please don't go away.
And it's not something that you really know yourself that you have it, because somebody else has to let you know that there's things going on at night.
Welcome back. We now are joined by Denny Doyle. Denny, thank you for joining us.
You're welcome.
Appreciate it. You know, I want you to tell, I always ask all of our guests to tell our studio audience and those at home a little bit about who you are.
I'm a retired GM worker.
Okay.
I had 30-some years at that, and
tell me, when is the first, not just sleep apnea, when is the first time you were told or you thought that you had problems with sleeping? Do you remember?
yeah, I was probably in my mid-40s.
Okay. How old are you now?
57.
Okay.
And it's not something that you really know yourself that you have it, because somebody else has to let you know that there's things going on at night. That.
Were you married or somebody?
Yes, I was married at the time,
okay.
And she really didn't say a whole lot about it.
Oh, really?
But whatever that reason was, I don't know. But it just, you don't, like I say, you don't know yourself.
You don't.
No,
Absolutely.
because you don't, because you're sleeping, but you're not sleeping.
And this is a key, one of the key messages we want to give today is that this is a diagnosis that often you don't make. I'll tell you personally, I have sleep apnea, and I did not know. My first experience, I was doing my fellowship training. So when you become a gastroenterologist like I am, you go through medical school, then you go through residency, which is for internal medicine for 3 years, and I was a fellow at the University of Michigan, and none of us had any money. So I was presenting at a conference, and there was somebody rooming with me, and then he had a presentation the day after, and that night he could not believe, because I was snoring and I think my breathing stopped. He was freaking out. The guy was so nervous, and he told me after the day after how bad it was. And really, I was single at the time, and I wasn't married, and so I didn't know this was happening. And sometimes even people that are close to you are really afraid of telling you. So it's important that if you are a loved one or a partner of a patient with sleep apnea, let them know, and let them know early, because this is a problem over time, can lead to some definite complications. Well, back to you. When did you suspect that some of this was sleep apnea? Eventually somebody told you, I hope.
Yes, well, what happened was it was my snoring. And that's really what attributes my problem. But we had some kids living with us from a foreign country.
Oh.
And they were in another room.
And they couldn't hear
one
it.
morning they asked my ex, "How do you sleep at night?" She says, "Well, some nights I don't."
Oh, wow.
And she had never really ever said anything to me about it. So, I didn't know. But yeah, my snoring was so bad that's what made me decide to go to the doctor and find out what was going on. And
How long did you wait?
Out.
How long did you wait between the time when you were told, that you were having this trouble snoring and seeing the doctor? How long did you take?
Oh, a matter of just a couple weeks, as soon as I could
Good.
get in.
Good.
Yes.
And this is an important thing. Denny did this, but a lot of people wait and wait and wait because, it'll be all right, I'm just snoring, it's not a big problem. But I think you're proactive, and that's the key, is that when you have this, we say this with lots of different conditions. When you have a problem, don't wait. Go see the doctor. Even if it's not something that you need to be concerned about, at least let a professional who really knows, how to deal with this tell you that. So now, what about other symptoms? Were you sleepy during the day? Do you remember, going back to when you were working at General Motors and even, after? Did you feel sleepy during the day?
Oh, absolutely. It's something that's been ongoing for years. And, you just attribute that to
Working
your
too hard.
lifestyle
Yeah.
and things like that. But, absolutely. Driving to work, hard time staying awake. I mean, I felt...
Driving to work.
To work.
So this is very important. He's in the morning, should be pretty rested, not in the evening working a double shift or something, and you're getting tired when you're going to work.
Yeah, I mean, I had issues before this where falling asleep at the wheel.
Oh, wow.
And waking up where...
The stoplight, right? You go to a stoplight, or so you stop. This is a classic scenario. You go to a stoplight, and there's no stimulation, and people nod off all the time. This is how dangerous this disease is. And people just say, "Oh, I'm just snoring, it's not a big deal," and they kind of laugh it off. But it can be more serious than that, can it?
Oh, absolutely. You're tired all the time.
How about your level of alertness? I mean, did you feel like there's a certain time that you couldn't give the best that you could?
Oh, absolutely. And that's where it comes into play at home. You get home and you're tired, no energy, and
You're done.
the family just, it's like, "Well, come on, Dad, let's go do this." "I'm too tired." It's 5 o'clock in the afternoon. But like I just said in the past, you attribute everything to work.
Right.
But that's not what it is.
Exactly. Important. Again, this is a recurrent theme that, not only do you not, first of all, it's dangerous if you fall asleep at the wheel or something like that happens. It's extremely dangerous, not only to you, but others. You don't give the best you can at work. And even more importantly, you miss out on your family. And people go through decades of this where they're missing out. I mean, there are people that work with me today that say, when I go home, this is 3 or 4 o'clock. I go to my couch and I'm out and I'm sleeping, and you miss the time that you have with your family, and that's to me, it's a tragedy. It really is. If you can, and we have therapy. If we couldn't do anything, people say, "Well, what's the point?" We can actually intervene and actually make your energy come back and give you the time you can get the best with your work and best with your family. We have to take a break, but we'll talk more with Denny when we come back. Please don't go away.
Yeah, no, yeah, it takes a little bit to get used to with the hose and everything. You know, you can't move around as much if you're a person that sleeps that way. And if you want to know, which you probably know this because you use a machine,
Yes.
this doesn't interfere with your sex life either.
Welcome back. You know, when we left you, we were talking with Denny and his experience with sleep apnea, and we were suspecting the diagnosis of sleep apnea. Denny, what do they do for testing for you?
Well, the first thing my doctor did was sent me to a heart doctor.
Okay.
And then this is stuff that I didn't realize it could attribute to it. But he did an echo, or I think that's what it was. And a few
An echo,
different
for
things.
those of you at home, is an ultrasound of the heart to find out what's going on. They did that. Okay, go ahead.
And so then they set up a sleep study, which is where you go in.
Yeah.
They hook you up to all kinds of wires and gizmos and gadgets. I mean, I don't know how many wires there are. And
1,000.
thousands, yeah. And then you're in a little room, and
With a bed.
with a bed, and they turn the lights off and say, "Go to sleep."
Right. So this is so that you know what's going on at home. It's a separate sleep center. So there's two ways of doing this. One is you can do a portable one at home, but most people have one in a center where you actually go in. They've got, I mean, literally, they've got you taped in the head, in the chest, every single way. You are sure when you go in there you're never going to be able to sleep. And I told them that when I had it, same thing as you, is that I said, there's no way I'm going to sleep. So what happened? Did you get to sleep finally?
Yeah, I think really that was probably one of the better night's sleep that I had. You know, I don't know what the reason for that was.
You just have to set you up with wires all the time.
Yeah. I mean, I don't know if because it was the darkness, the temperature and stuff, but yeah.
Okay.
And then, you know, when it's time to wake up, whether you're awake or not, because you tell them what time you normally go to bed, what time you normally get up in the morning.
Yeah.
So if I told them 6 o'clock I had to get up,
They got you up.
6 o'clock, you're up in
Okay.
5 minutes, you're out there and you're gone.
So it wasn't a hard test then.
Oh, no.
Good.
No.
So people get, you know, apprehensive about what the test is like. It's a pretty easy test. All you do is, I mean, they hook you up with a lot of wires, obviously, but it's not hard. You sleep, then you wake up, they take off the wires, and you go about your business. And then you go, did you see your doctor a little bit later, or how did you find the results?
Yeah, I went back to my doctor.
Yeah.
And he told me what the results were and set me up to get a CPAP machine.
And what were the results? Do you remember?
Not totally, but I know, and I don't really know how the numbers
They
work.
told you it was sleep apnea. Then.
Yeah, they told me I had obstructive sleep apnea.
Good.
And
So just so those of you at home wondering how do they know, what they try to find out is how low your oxygen level goes down, you know, when you have this test. So, you know, mine went down pretty low. I mean, mine went down to 75%. So, you know, 75% is not normal for those of you at home. You know, you have to get at least in the 90s to be normal. I went down to 75%, did not even know. They said I woke up 245 times that night, and I didn't even know.
I got you beat on that one.
How'd you get? How many?
257.
Overachiever.
And but my oxygen level was 81.
Oh, 74, I got that one.
Yeah.
Anyway, but the point is, all this is going on, and we have no idea. You didn't have any idea.
No.
And so it's waking up at night, and why does that matter? People say, well, you're sleeping, aren't you? Why does it matter? You're sleeping through the night. Who cares if you wake up as long as you go back to sleep? It's because you don't get the restorative sleep, the sleep that you need to basically get the energy you need the next day.
You don't know you wake up.
Exactly. So you were diagnosed with the sleep apnea, and then what was the treatment? What did they tell you?
They gave me a CPAP machine.
Okay.
And which is just a little, kind of like a little air pump.
Okay.
And one of the things they do when they're doing the study is you have your CPAP machine on there too. So
You bought one today? Okay.
Yes, this is the mask they have you wear.
Yeah.
So
Little Darth Vader look, but it'll be
yeah,
fine.
you just slip this bad boy on.
It is a Darth Vader look. I like it.
And
Luke,
the Force.
I'm your father.
And you know they got a hose here that goes to a pump,
Yes.
and they adjust the pressures to where whatever helps you sleep the best.
So we were joking a little bit, but basically there's a attachment to this. If you could take a look, and then they put pressure through there basically to overcome the pressure that you have that's stopping you from breathing. And you'd use it all the time. It's pretty comfortable, right?
Yeah, no, yeah, it takes a little bit to get used to with the hose and everything. You know, you can't move around as much if you're a person that sleeps that way. And if you want to know, which you probably know this because you use a machine,
Yes.
this doesn't interfere with your sex life either.
One more time.
It does not interfere with your sex life.
Important, and we're kind of making a little light of it, but you know, you would be surprised how many people don't use it because of, they don't even know, they're looking at it, that, you know, what it's going to do. They think it's going to be so uncomfortable, I can't do this. And it is important. Intimacy, people say, oh, I'm not going to be able to be intimate, but you probably have more energy to do something than you did when you didn't have the mask on. So, you know, don't let that stop you. And here's Denny telling you his sex life is as good or better than it was before the mask. So you heard it here. So now how about the rest of it? Now how about your energy during the day? And the energy that you have, do you feel like you don't, you know, fall asleep at the wheel? All those things have increased?
Oh, absolutely. I mean, it's unbelievable, the difference.
Okay.
I mean, I don't know what somebody that gets great sleep, you know, what their energy level is or how they react during the day, but me personally, yeah, it's made a big difference.
Awesome. And you hear this all the time. People say it's night and day, you know, because it's the same with me. I mean, I just like you, and I didn't get a lot of sleep, and I said, yo, well, it's because of the fact I don't get much sleep. But the sleep that I get, you know, you don't dream very much because you don't go in that deep sleep to get the dream. So it can really affect your energy. It can affect your life overall, not your work life, your personal life. So, and it's a pretty easy fix. I mean, this is a machine. It's hard. He's got the mask on, but the machine, you can, for those of you who travel for work or business, you can take that with you, and it's really quite a device that helps your life. Denny, thank you for taking the time and sharing so people know what it's like. I really appreciate it.
You're welcome.
When we come back, we'll be joined by our pulmonologist, Dr. Matthew Trunsky. Please don't go away. Awesome job. Thanks for bringing that on.
But not all snoring is sleep apnea. Sleep apnea is really the cessation of breathing during sleep. And the question I'll typically ask a wife, is not, does he snore, but does he stop breathing to the point where you think he's dead and you got to give him the elbow so that he wakes back up.
That's what they're talking to. And then they take me over to the camera. Welcome back. Thanks for staying with us. You know, we now have Dr. Matthew Trunsky, our pulmonologist. Dr. Trunsky, thanks for coming on.
Oh, you're welcome.
Question for you. How common is obstructive sleep apnea? In your practice in America, I mean, would you say it's pretty common?
I would say it's tremendously underdiagnosed and very common. And it's almost epidemic because, as you've alluded to, bad sleep apnea can be associated with heart attack, stroke, and early death. And so it's something that physicians don't think of to ask, and it's just not getting diagnosed frequently enough.
Yeah, and the important point is that, you know, it's underdiagnosed because of the fact that people don't even know they have it, number one. And you heard Denny's story. I mean, he had it for a long, long time, and nobody really told him. If he had been told earlier, he would have come in. And why do we care? Again, it's like a broken record. It's because it can lead to other problems. Talk about stroke, high blood pressure. I mean, the list is many. Now, what happens? People who don't know a lot about lung disease or airway disease, what's the mechanism of obstructive sleep apnea? What happens?
It's amazing. And back to Denny, because he actually went to his doctor to say, I think I have this. Most patients come to see me for a cough or shortness of breath, probably unrelated, and they leave with a sleep study appointment rather than what they came for. What happens is that the tissues in the neck, when you get to deep sleep or REM sleep, you lose control of those tissues. And people who are larger, typically, people with neck collar sizes bigger than 17 inches or bigger, when you lose control of those muscles, when you get to deep sleep or REM sleep, you stop breathing. Those muscles obstruct the airway. When the airway is obstructed, you can't breathe. What happens is when you get to REM sleep, that's where we get restored. That's good quality sleep. But people spend a disproportionate time in superficial sleep, not REM sleep, and that's why they're tired the next day. As a result of not breathing, as you alluded to, oxygen levels fall, and over time that puts stress on the heart and the lungs, and over time that leads to heart attack, stroke, and death.
That's well put. So the idea is that when you get sleepy enough and the muscles relax, the muscles to a point where there's obstruction to actually air going through, and when that happens, you get to a low enough oxygen level, your body wakes you up. And wakes you up to the point where enough so that you get the oxygen levels back up. And then you don't wake up, but what happens, you never get to that deep sleep and that restorative sleep, and so that's why you have a problem.
You shift from REM sleep to stage 1, stage 2 sleep. It's just not restorative. So people say, you know, doctor, I'm fine. I don't have a problem sleeping. I sleep 8 hours. I never wake up. but the quality of the sleep is so poor.
That you don't get the restorative sleep. Absolutely.
Absolutely.
And so it's important that you can see what happens at night affects you during the day. And for those of you who don't have sleep apnea and who don't just get sleep at all, how important it is, you know, to talk about sleep and restorative sleep. Now, what about this snoring? People think I'm snoring. Is that just the fact that I'm obstructing? Is all sleep apnea just snoring?
No, and I think snoring certainly associated with sleep apnea, as Denny alluded to.
Yeah.
People in the other room were saying that they could hear him snoring. So it's certainly more common in that instance, but not all snoring is sleep apnea. Sleep apnea is really the cessation of breathing during sleep. And the question I'll typically ask a wife, is not, does he snore, but does he stop breathing to the point where you think he's dead and you got to give him the elbow so that he wakes back up? And that's incredibly common.
It is, and this is, I mean, he's saying it, and it sounds a little funny that you're dead. It's scary because people stop breathing for such a long time that you know, you're worried what happened to them, and that's sometimes what the trigger is to go see the doctor. So important points for those of you who are watching at home. It's not just snoring, because lots of people snore, but do you stop breathing? And that's the key. So it's sleep apnea, the stoppage of sleep. Now, lots of people have sleep difficulties. When should they come and see you or a specialist to talk about sleep apnea?
I think a lot of it is really the onus on the physician. If someone is overweight, someone has a big neck, comorbid conditions like diabetes, heart disease, to me that's a no-brainer. You should automatically have a sleep study. We see a lot of patients in their 50s getting bypass surgery who are built like a guard on the Lions who have never had a sleep study, never had it mentioned. Those are people that need to be tested. But some of the symptoms patients can look for are daytime sleepiness, morning headaches, swelling in the extremities, falling asleep driving, all kinds of that stuff, without really having enough energy to get through their day.
So really good tips that Dr. Trunsky talked about. Obviously the stuff we talked about, snoring and stopping the breathing, but even if you don't experience that, if you're somebody at risk who's obese, have a really large neck circumference, we talked about 17 as a magic number, but this falling asleep during the daytime or being sleepy and not being alert, and then he talked about the classic where you're driving and you feel like you're gonna fall asleep. The one that I hear about a lot is you're at a stoplight or something stops and you're nodding off. If any of those things are happening, even if you're not suspecting sleep apnea, at least go see somebody who can tell you what to do next. And the key is to be proactive so that you don't get what he's talking about, that you don't get the complications and you don't get diseases much earlier than you're supposed to. And that's the key. The key, again, in our shows always is prevention. Any of those signs that you see, you go and see your regular doctor who can then point you in the right direction. And it may be that you don't have it, you can have a different problem, but at least you're pointing in the right direction. And that's what's important, that you want to be proactive and not wait till it's too late. We'll have to take a break. More with Dr. Trunsky when we come back. Please don't go away. Excuse me, right?
As you've said, CPAP is continuous positive airway pressure. And to explain what it really is, it's a continuous flow of air coming at you through the mask. It's very similar, for instance, if you drive down a street at a constant speed and put your head out a window like a dog, that is CPAP.
Welcome back. When we left, we were talking with Dr. Trunsky about sleep apnea. Now, what do you think about Denny's story? Was it typical? Do you think that it's a little different than what you see normally?
The most atypical thing about Denny's story is that he was proactive and went to his doctor and said, I think I have this diagnosis. Typically, again, patients never know they have it. They're coming for something else and someone has to raise the red flag based on symptoms. A lot of times we hand out a questionnaire that asks patients how sleepy they are. And that's one good screening measure to look for it. But I think that's the most atypical thing.
So you give them a questionnaire? What kind of questionnaire?
Asking questions. Do you fall asleep? Do you take naps? Do you fall asleep watching TV? Do you fall asleep driving? And they tally up a point. So it's usually used by a sleep specialist. Denny's story is fairly typical, though, in terms of the fact that he feels better after he treats the disease. He's got a lot more energy in the daytime. He's not falling asleep. I think that CPAP is almost like plugging in a battery at night to recharge you, so you do better in the daytime.
That's a good idea. So I like that. I said, plug your battery in at night, and then you're better during the day. It's an awesome tip. But Denny's story, and he said he was very proactive. Two things that I thought was atypical. Number one, that he one and said, I have sleep apnea. Number two is he was sent to a heart doctor. And I'm not sure what the reason was, but he got to the right place. So what about, his CPAP is working very well, and even with the Darth Vader look, it's comfortable and he's doing well with it. But what about surgery? We talk about surgery sometimes. What do you think? How effective is that for sleep apnea?
I think it's becoming less favorable. CPAP is still the gold standard. CPAP still works the best. There's more data on it. The people that can sometimes benefit from surgery are people, number one, that still have tonsils in, because the goal of surgery is to enlarge the back of the throat, the pharynx, by cutting out the tonsils, part of the soft palate, and the uvula that hangs down in the back. And by doing, it's a fairly extreme procedure, and by doing that, they hope to widen the airway so that the
to make a bigger
airway
opening
doesn't
Yeah.
collapse when you get into that REM sleep. I think automatically, if you've had your tonsils out, you're not a good candidate for it, but you really need a surgeon who can look at your anatomy to say, this may work, and then it's going to be about a 50-50 chance. In reality, it doesn't work as well as CPAP. CPAP is still a much better way of treating this.
Yeah, and I agree. So, if you're thinking about surgery, my opinion would be that, at least get the CPAP first and see if it works, because it works so well for so many people. And you may hear many claims of, I heard my friend or my neighbor, et cetera, that had this problem and then had surgery and got fixed. But in reality, many people have surgery and it doesn't get fixed, and they may need a CPAP machine afterwards. So, like Dr. Trunsky said, that, that it can work for some people, obviously. I don't want to say it doesn't, but I would recommend trying it first. So, we were talking about CPAP and the gold standard or the best treatment. How does it actually work? How does CPAP help with this disease, especially with obstructive sleep apnea?
And as you've said, CPAP is continuous positive airway pressure. And to explain what it really is, it's a continuous flow of air coming at you through the mask. It's very similar, for instance, if you drive down a street at a constant speed and put your head out a window like a dog, that is CPAP.
Nice.
What it does is patients who can't tolerate it, though, when you say that, and just say it's that gush of air, all of a sudden they're like, oh, it's not so bad, I can do that. But the positive pressure overcomes the resistance in the throat. So in essence, it's pushing the musculature apart to create the airway.
So you actually kind of maybe blow dry your hair as well if you'd like at night, because the air will come through. But the idea is that you overcome the pressure with the continuous air.
And it's important to note that everyone's not the same. So after you get diagnosed with sleep apnea, you go back to be fit with the CPAP mask, and they try and choose the least amount of pressure that you need, because a lower pressure is better tolerated, to enable the airway to stay patent.
And so what they do is, it's a very important point, what they do is after you have the initial test to find out that you have sleep apnea, what they do then is fit you with the mask and the amount of pressure you need, and they have you go through the same sleep study to find out if it's effective for you. And if it is, then you're like Denny and it could be successful. One question, we talk about obesity as a risk factor for sleep apnea. Is everybody with sleep apnea obese?
Everybody with sleep apnea is not obese, but there certainly is a very strong correlation with that. I think it has to do more with the internal anatomy as well. And more than anything, you have to be guided by symptoms. And if you have the symptoms that would make you think of sleep apnea, obese or not obese, big neck, small neck, those are people that still should be tested.
Perfect. So it's like we've talked about any other disease. We look at risk factors for a disease, but often, we find people without the risk factors that have it. And as you said, very poignantly, is that if you have the problem, it doesn't matter if you're obese or not, if you don't have the characteristic. But I think also the point is that I wouldn't have the stigma or the idea that, I couldn't have sleep apnea because of the fact my neck is small and I'm not overweight. You look, you do your Google search and say, I saw that sleep apnea is with this kind of person. It can't be me. It very well can be you, because again, it's about what the space is like, what happens when you go to sleep. And if you have the problems, either your loved one or your spouse says that you have these problems when you stop breathing, or you have the problems we talked about, which is daytime sleepiness or falling asleep at the wheel, etc. Go get tested. That's the problem. There are no rules when it comes to these diseases. So just if you have the symptoms, go get tested, and you could have a really, really, really good outcome like Denny. And the idea is prevention. We have to take a break. When we come back, we'll answer some questions from our studio audience. Dr. Trunsky will stay with me. Please don't go away.
In obese people trying to lose weight, I view CPAP and sleep apnea treatment as the catalyst that allows you to do it, because you all of a sudden have more energy during the daytime and you're not coming home and just reaching for the remote control. You may actually get up and go for a walk. So it's a good jump start to get your lifestyle changed and get rid of the obesity and get rid of the sleep apnea.
Welcome back. It's now time to take some questions from our studio audience. And Dr. Trunsky, this will be about sleep apnea, so we'll take all these questions one as they come, okay? Sure. Yes, sir. First question.
I have a pretty much overall thin build, but have a slight droopy chin. Could that be the cause of sleep apnea?
Hey, we're talking about that, that people think that if I'm not obese, there's no way I could have sleep apnea. So what about this question, Dr. Trunsky, about the chin? What do you think?
My feeling is, again, it's more involved with the interior anatomy rather than the exterior anatomy, and I would be driven more by your symptoms. So if you had some of the symptoms we talked about earlier, then I would think about being tested for sleep apnea, but not solely on the basis of having your chin.
Yeah, and again, it's important if you have, like they talk about the thick neck circumference and the obesity, but like you said, the actual airway is going not from what's on the outside, but inside. So most likely the chin is not playing a role. But we can't say this enough. If you have symptoms, irrespective of what your build is, go and see a doctor. And it may be that you have this condition, maybe it's not. But the idea is to get tested so you know from experienced hands. Next question.
Hi, doctors. Does sleep apnea run in the family?
It's a great question because often you have families that have people that they, my dad had it, my grandfather had it. What about that question, Dr. Trunsky? Does it actually genetically run in families, and what's the significance of that?
There certainly is a genetic predisposition to having obstructive sleep apnea run in families. Not all cases are familiar like that, but certainly you find, as you said, that if your father has it, you're more likely to have it as well. It's based again on that build and the data we talked about.
So an important point that if you have somebody in the family who has sleep apnea, your chances are increased. But we've talked about other things like this in previous shows, that you may have a family history of something, but it's not just that determines it. It's how that's carried out in your other risk factors. So, for example, if you're someone who is not getting physical exercise, if you're not getting if you're not following the right diet and you're obese, then the risk factor of being obese is as important as the family history. And you try to do, if you already have a predisposition, and you can try to reduce those risk factors. So, would you say, Dr. Trunsky, that if your dad or your grandfather or your grandma had this, then you should probably be a little bit even more careful about your diet and careful about your activities, right?
Absolutely, and I'd add even that in obese people trying to lose weight, I view CPAP and sleep apnea treatment as the catalyst that allows you to do it, because you all of a sudden have more energy during the daytime and you're not coming home and just reaching for the remote control. You may actually get up and go for a walk. So it's a good jump start to get your lifestyle changed and get rid of the obesity and get rid of the sleep apnea.
That's a great point. So the idea is that so one leads to another. If you have more energy, you can actually lose weight. But the question specifically about the family history, absolutely it is a risk factor. But look at what you can do besides that. You're not stuck with it. You can do things. Be proactive and understand what the risk factors and do what you can. Physical activity, eating correctly to try to decrease that risk as much as possible. Next question. Yes, sir.
Hi, doctors.
Hi.
Do young children get sleep apnea?
Well, it's a great question because you think is it just an adults? Dr. Trunsky, what about kids? Do they get sleep apnea?
They do. It's very common. The physiology is a little bit different in so much as it's usually a tonsillar problem with them. So different from an adult. Children do benefit from surgery because when you take the tonsils out, very, very frequently will cure the sleep apnea.
So the answer to the question is that yes, kids do get sleep apnea, and for them that the treatment may be very different or be more effective with the surgery than the CPAP. Now, do they get the same kind of testing as the adults do?
They do. I mean, you just want to end up in a certified, accredited lab, and most of those labs take care of children too.
And so if you go and you get tested, sometimes, we didn't talk about this, there are some places that you can actually get home testing, but it's usually for milder cases, and you don't have the sophistication that the sleep study has in the sleep center. Now, would you say that mild cases can be sometimes looked at home? What do you think?
I think there's a movement to diagnosing this at home overall. I'm not sure the statistics or the numbers, but it tends to be probably less expensive to do a home sleep study. But the quality, I think, is still a little bit suspect, and you don't get all the data points that we would get from a sleep study done in the lab.
And remember we talked about it, we were kind of joking, there's 1,000 wires coming out of your body. And the idea is all those wires, you know, you can check the oxygen saturation, maybe even the EKG, but it's more than that. You know, they actually have brain activity tested, and sometimes even the leg activity tested when you do a sleep study in a sleep center, and that's more sophisticated. And the brain activity is important as well, right, Dr. Trunsky?
Well, the brain activity is what's used to let us know if you're in REM sleep, deep sleep, or which stage of sleep you're in, so they can calculate how much time is spent in each stage of sleep.
And when Dr. Trunsky's been talking, you know, a couple of times about REM sleep, so you know it's REM is REM, rapid eye movement sleep, and that's important because you're deep restorative sleep. And like he's talked about before, if you have this disease, the key is that you don't get to that restorative sleep, and so you may not get that with a home study. And it's important because those of us at home or watching have no idea, so, you know, because you'll be given those options sometimes to do a home study, and predominantly because it's cheaper, and sometimes say, you know what, why don't we try the home study? In fact, it was interesting, in my insurance questionnaire, I think it was written, you know, why does this patient not qualify for a home study? And I think there was a reason that the doctor gave, because we need, you know, more sophisticated studies. But just so you understand, to be advocates for yourself, that if you have this, you know, I think that I would recommend that everybody have a center, go to a center that you can have the best sleep study you can. We have to take a break. When we come back, more questions from our studio audience. Please don't go away.
And anything that's a sedative of any way, alcohol, anesthetics, are going to make mild sleep apnea worse and moderate sleep apnea worse.
Welcome back, and thanks for staying with us. When we left, we were answering some questions from our studio audience. Yes, next question, please.
I have a friend who has sleep apnea, and he's getting ready to have some surgery. How will the anesthesia affect him?
Well, that's a great question, because, you know, with anesthetics, you often go into a deep sleep, and people worry about the oxygen levels up. Dr. Trunsky, what do you think? I mean, you're a lung doctor, pulmonary doctor, and somebody comes to you and says, you know, I have sleep apnea, I have a surgery scheduled, and what should you say? What
Quite honestly, it's a big issue, and it's oftentimes not picked up before the surgery, and the sleep apnea is diagnosed after the surgery when the anesthetics are still on board, and it's not the right way to diagnose it, because I think it increases the risk to patients when they don't know that's going to happen. We can certainly treat it when people are in the hospital after surgery, but you're always better off having your known diagnosis and bringing your machine in to the hospital with you. It is a true finding.
Well, what's the? I mean, it may be simple for us because we've seen it, but for those who are at home watching, what's the risk? Why does it matter?
Because
they can give oxygen anyway, right? I mean, why does it matter?
It's not an issue with oxygen, because oxygen can't get to your lungs if your throat's blocked. And anything that's a sedative of any way, alcohol, anesthetics, are going to make mild sleep apnea worse and moderate sleep apnea worse. So it just makes the whole thing more difficult to treat. And I think the big issue is it increases the risk to patients who are undergoing surgery. We see all of the open heart patients, for instance, at Troy Beaumont, and I would say at least 2 or 3 times a week, and my initial recommendations are, let's get the patient off the ventilator and let's make sure we get an outpatient sleep study when this is all taken care of. That's
a great point. So, you know, we see it all the time. Even when I do endoscopy, and endoscopy sometimes requires an anesthetic, and what we see is people who we diagnose sleep apnea on the undiagnosed, and what happens is that their oxygen saturation goes down, and your point is right on, is that, you know, you would think that why does it matter? You have a controlled situation, is because you have an obstruction and you may not be able to raise the oxygen level quickly, and you increase the risk to that patient. So it's extremely important to know before rather than after, and tell your doctor so they can be aware. And again, you know, any form of an anesthetic that puts you deeper into your sleep replicates what you do at home to even a higher degree. So you got to really be very, very careful. It's a great question. Next question.
I heard they have oral appliances to help with sleep apnea. Is this true?
Yeah, so not a CPAP, but some appliance that actually keep your mouth open or forward. Dr. Trunsky, what about that as an alternative? Because people, well, frankly, people sometimes are afraid of the CPAP machine, even though Denny had good experience. They think, there's something in my face, I'm going to suffocate. What about these oral appliances?
I think they're becoming much more popular. I think, again, it depends on the anatomy, the internal anatomy of the patient. And what they do is they thrust the lower jaw forward, in essence, to keep the tissues from blocking when you hit those apneic episodes. I'm a believer that if they're used, you should be tested afterwards to make sure they're doing their job.
Exactly right.
I take care of one of the person who invented one, and I was insistent that he went back and be tested again with his own device, and it did correct him partially, but not completely. So he now wears the device, wears his own bite plate and CPAP, but he has a much less pressure of CPAP because the bite block does work somewhat.
So the answer is that, does this oral appliance actually work? It can work. I think Dr. Trunsky made a key point. What you have to do is with the CPAP machine, you're being titrated. You go and get another sleep study to find out if this is actually working. If you're going to use an oral appliance, have the same criteria. Go back and find out if it's actually effective for you. And it can work, but it may not work as well. And so the idea is that if you're just moving things forward, it may not still stop the blockage or the obstruction that you can have. And so great point about going back to get the sleep study. Yes, Dr. Trunsky.
Much probably more effective than surgery overall as well. Much less invasive than surgery as well.
Yeah, because surgery can be quite invasive. You're absolutely right. So if you have the option, again, in general, not just with sleep apnea, there are many options for treatment. Just be informed, ask your doctor, and then find out what you can do. And if it's an adjunct, meaning that it can work with your CPAP device, why not? Next question. Yes, ma'am.
Hi, doctors.
Hi.
I have sleep apnea, and I read that strengthening the muscles around the throat can really help sleep apnea. Does this really happen?
And, Dr. Trunsky really eloquently said it in when we were talking previously, is that the relaxation of the throat muscles when you're sleeping actually leads to the obstruction. So it would be, I guess you could think that if you strengthen those muscles. What do you think about that?
I don't know any data on that. I'm skeptical.
Yeah. So absolutely, there's no controlled trials. The answer is no controlled trials on looking at that. But there are various cultures where they've looked at that they actually have exercises that they strengthen their throat muscles, and have seen that some of their sleep apnea symptoms have gone away. That's very different than what Dr. Trunsky is asking for, which are studies. So is it that you do these strengthening exercises and then have a sleep study, and does it go away? It's a very different question. And much of the studies are talking about observational. People look and see, they haven't stopped breathing as much, and they don't snore as much. That's a very different question or problem than we're talking about. Is there actual physiologic, which means that are you looking at a study and finding out, does the oxygen level go down? Does the brain activity actually change so you're getting the restorative sleep? So again, when you read about this or see it in some show, it doesn't mean that it's always true. Look at the evidence, ask your doctor. I'm also thank you, Dr. Trunsky, for coming and answering all these questions. I appreciate it. And also thank you, Denny, for telling us about your experience with sleep apnea and the improvement in your sex life. Don't go away. When we come back, Partha's prescription. Welcome back. Thanks for staying with us. Today we've talked about sleep apnea, a potentially deadly disease. What can we take away from today's Partha's prescriptions? Number one, be proactive. If you're sleepy during the day and have decreased alertness and energy, please see your doctor. Sleep apnea could be the culprit. Number two, prevention is the key. Obesity and smoking can worsen sleep apnea. Maintain a healthy weight and stop smoking. Number three, if you're diagnosed with sleep apnea and use a CPAP, please continue to use it. It could save you from the complications of sleep apnea. Number four, join the American Sleep Apnea Association and the Awake support group. Alert, well, and keeping energetic. Advocate for those with sleep apnea and their families. For more information on sleep apnea or an archive of our previous topics, please visit us at our website at www.askdrnandi.com and join the discussion on our Facebook and Twitter pages. Just search Ask Dr. Nandi. Lastly, there's a beautiful word in the Hindi language that literally means the light in me. honors the light in you. And that word is namaste. So namaste to each and every one of you, and thank you for watching. See you next time.